Assalamualaikum doctors. In this video I am discussing how can we manage primary ciliary dyskinesia patient, PCD patient. So in the history, it is an autosomal recessive condition, we know that. So after taking history, I will revise my note, I will examine the child. I will examine first airway, breathing, circulation, dehydration status, then the vitals, heart rate, respiratory rate, blood pressures, pulse rate, these are everything. And then I will examine his chest examinations, respiratory system fully, abdomen examinations for the liver, head examination for any shunt, and ENT examination for any sinusitis, nasal polyp, conductive hair loss due to recurrent otitis media, may have hearing aid or cochlear implant. So hearing also we test. Then I will run some tests. Screening test. Remember saccharin test. It is a bedside test for screening. So saccharin test, it is a bedside test for screening. Nasal exhaled nitric oxide measurement, which is low in primary ciliary dyskinesia, used in younger children 4 years. Nitric oxide is low in PCD, primary ciliary dyskinesia, cystic fibrosis, allergic rhinitis, and high in asthma. So saccharin test and nasal exhaled nitric oxide measurement. Saccharin test is a bedside test and nasal exhaled nitric oxide test, which is low in primary ciliary dyskinesia. Then confirmatory or ciliary brush biopsy. Nasociliary brushings from the terminate are assessed by photometry, giving a beat frequency, and electron microscopy will reveal ultrastructural abnormalities. And investigations for associations are abdominal ultrasound for situs inversus, other GI problems like volvulus, duodenal ataxia, tracheoesophageal fistula, and GI operations. Echo for dextrocardia and VSD. Okay. So investigation we understand, one is screening, one is confirmatory, one is investigation for associations. So screening test, bedside or saccharin test we are doing, and also nasal exhaled nitric oxide test, which is low in primary ciliary dyskinesia. And then confirmatory test, ciliary brush biopsy. That is nasociliary brushing from the terminate are assessed by photometry, giving a beat frequency, and electron microscopy will reveal ultrastructural abnormalities. Then investigation for association, that is abdominal ultrasound for situs inversus, other GI problems like volvulus, duodenal ataxia, tracheoesophageal fistula, and GI operations. Echo for dextrocardia and VSD. Prognosis. What is the prognosis of primary ciliary dyskinesia? That is normal lifespan if diagnosed early, plus managed properly. So that is, and how can we management? First of all, multidisciplinary team, pediatricians, physiotherapist, dietitian, audiologist, vaccination team lies with the school, psychological support, these are. So again, pediatrician, physiotherapist, dietitian, then audiologist, vaccination team lies with the school, psychological support, also geneticist or genetic advice, because it is an autosomal recessive conditions. And treatment we are giving prophylactic, antibiotic, bronchiectasis, bronchodilator we are giving, mucolytics, then immunization, influenza plus advice giving, education aids compliance to the treatment of complication and association with the ENT, obstetric and gynecologist, because infertility is a problem. So treatment we are giving what? Prophylactic, antibiotic, bronchodilators, then mucolytic agent, immunizations, education about to compliance with the treatment, and treatment of complication and association. That's why ENT and obstetrics and gynecologist. And we give advice like avoid smoking and allergens, avoid overcrowding, good aeration and housing, annual influenza vaccine, hearing regularly monitored. So avoid crowding, avoid smoking, annual influenza vaccine, hearing monitoring, hearing checkup, then he will be good aeration and housing. These are he will do. And in treatment I already tell that antibiotic prophylaxis, bronchodilator, mucolytic agent, then immunizations, education about the compliance of the treatment, and treatment of complication and association we are involving ENT and obstetrics and gynecologist. So this is all about the management of primary ciliary dyskinesia. Thank you.